Thank you for this invitation at this ISOP conference in Athens. It was a pleasure for the Cultural Association of Pediatricians, which I represent. I am a primary care, I have been, in fact, a primary care pediatrician. I retired a year ago, and now I'm dedicated to our association. Some brief notes about this association. It just celebrated a few weeks ago 50 years of age, so we're middle-aged, and we were born in 1974. I'm just telling you this because it was born from a sort of a cultural revolution within the universities at the time, from three academic professors who started having a different perspective regarding the role of pediatrics in Italy, and with a framework which regarded what was really happening at the time in the territories, and where we were starting to speak about the interest regarding a figure which became, after 4 years, the primary care pediatricians, the family pediatricians. In Italy, we have, as you maybe know, a health system which is public. So all these services are provided by this public health system. And 4 years after this, in 1978, in Italy, the public health system was born, okay? And now we have primary care pediatricians, consultories where sort of a health districts for families, for children, and also for adults. I will speak to you about LGBTQA friendly services and about an experience which I will go into tell you about. And the names you see under mine are there because actually these three people who are not here today are the main actors of this experience, which is starting in a region of Italy, which is Emilia-Romagna region. I will show it to you in the map after a few slides. Okay. Why all this? Because Emma introduced very well what I'm going to speak about, citing a lot of scientific bibliography. And because, as she has said, in thinking about a service for transgender people, there are some risks that we need to overcome and some peculiarities. There's a risk of generalization, as you have seen during Emma presentations, because the risk is to put a lot of experience into a single category, okay? Nevertheless, we know that there are different ways of expressing transgender identity, and we do with other health problems, more complex health problems, and when we have a child with vulnerability or a family, we need to intersect this problem with some other variables which regard many things: socioeconomic status, culture, age, and even the politics that are present in that moment in the community or in the region. And the risk is of prejudice and stereotypes. And this is a problem for this kind of population. The book you see on your right side, yes, right, was published by the region Emilia-Romagna, which is in the northern part of Italy, and it is a practical guide written by the Health Regional Service for all professionals who work in services for transgender population. And at the publication of this book, and considering that in Italy, as it happens in many other countries, but I don't think only in Europe, the transgender and gender non-conforming populations experience, in fact, disproportionate levels of stigma and harmful health effects. On the health side, there are very important critical issues, and one of these is the access to services, health services for these populations, and access to resources considered determinants of health, such as education, employment, and housing. So all these, an inclusive perspective, which include this population, to make them shift from a sort of unexpected user of services, of health services, a population which we do not expect to see because we're not trained to see it, from an expector user through a friendly service which welcomes them, and finally to a welcome user. So make them feel in a service which is waiting for them and which will welcome them. This shift, as Emma underlined also, is not easy to obtain because it needs a lot of work, multi-professional work and multi-sectoral work. This to promote their access to services. Okay, so this is a new experience. It started a few months ago in the Emilia-Romagna region. In fact, the region is called Emilia-Romagna because there are two territories, one in the north, which is Emilia, and one in the south, which is Romagna. Bologna, which maybe you may know, which is the capital of the region, is in the northern part, and there are some other cities in the southern part. I'm speaking about the southern part, the Romagna region. It all started from what? From the necessity to respond to needs which were intercepted by the professionals who worked in the services, and also from the needs coming from the special teams which we have in the health services, which regard people with eating disorders, for example, or from the Center of Mental Health Problems, so psychopathologies, and many other pathologies, psychotic pathologies. So we try to adapt the services using the resources in the field, and this is very interesting, with a sort of approach work, with a specific focus on literacy. When I speak about literacy, I speak about the appropriate language that the professionals use, because this is a very important need for the transgender population. And this experience is still ongoing. So we intercepted the need through the adolescents who approached the youth space, which I will show you to you, and the adolescent outpatient clinic, and the adolescents followed by multi-professional teams. They came from these teams with a sort of comorbidities, okay? And among these comorbidities, the problem of being transgender emerged. So they were referred to this service. This is Italy. You know, it's named after, it looks like a boot, okay? And the Emilia-Romagna region, you see it is up on the north. And we're speaking about a local health district with 3 health districts with a population of 380,000 people, 2 provincial hospitals and 2 local hospitals, 240 general practitioners, 50 primary care pediatricians. We know that there is a huge range in the percentage of the transgender population. So the data need to be somehow evaluated. And the local health authority has an equality plan program with a specific aim, objective, towards the gender medicine and LGBTQA community through, I will go a bit faster in order to finish in time, the implementation of epidemiological studies, staff training, and actions aimed to promoting equality and humanized care, starting from the individual who approaches the service. This is the organization model that we have in Emilia-Romagna and in Romagna. In fact, we have a family consultatory. We're all speaking about public services, so they're free services, which deals with physical and mental health of women, of couples, of families, and also in pregnancy care and cancer prevention. There's an outpatient clinic focused on adolescents with clinical activities aimed at adolescents between 14 and 19 years of age. In Italy, we have primary care pediatricians, family pediatricians who take care of children since they are born up to 14 years or for 16 years for children with complex problems. After that age, there's a sort of a limbo. because the transition towards adult care is not an easy transition. And now we're trying politically to change this and bring pediatric age to 18 years, because we think that there are still adolescents. Well, even at 30 years, some people are still adolescents, but that's another problem. And we have a youth space with a low threshold service for adolescents in this range of age, with a free access dedicated to them, for them. These are the youth spaces in Cesena, which is one of the main cities in the southern part of the Emilia-Romagna region. As you can see, there are spaces, nice spaces for people, for adolescents. And the teams, the multi-professional teams are these. I will not go into specific, but eating behavior disorder team with this kind of professionals, team for psychopathology of adolescents with neuropsychiatrists, psychologists, and social workers, and the transition to adult team, what I was speaking about just a few minutes ago. This is a beaten bridge, and we need to make it straight to have people, adolescents, go from one to the other. And this is a very complex transition, especially when we speak about complex needs. So there are many problems to be solved. I marked here the use of appropriate language because I think it is very important. And this is a book which was published by the region, and the title is Parole per includere, which means words to be included, for inclusion. And there's a glossary that regards all the definitions and all the appropriateness in language which the professionals need to approach the transgender population. So the actions, the establishment of a gender identity team, putting together all the complex teams, trying to improve the knowledge through a training, internal and corporate training. It was cited by Emma the need of a pre-service training during the curricula of people, for example, pediatricians, doing the specialization. And this is an important problem which we're trying to somehow solve with our association through the universities and specializing schools, sharing language, and this they do through periodic team meetings and defining the pathway, which is a clinical pathway and a social pathways. These are the tools: review of the formulary, appropriate language of the staff, construction of a clinical pathway and specific pathways. The social path is extremely important, and it is transversal to the clinical pathway because it enables interactions in one social space. If you think about behavior, clothing, for example, the name of choice, which is not a secondary issue, but it is a primary issue. And we have in Italy the school alias career. It is a confidential agreement, for example, between school family, if it is a minor and trans student, through which the trans person asks to be recognized a name by the name he or she chooses to be called with, okay? And the clinical path, there's a direct request from the adolescents, a dedicated mail or other ways to communicate. There are external professionals which can guide the adolescents or pre-adolescents with these kind of problems. I'm speaking about family pediatricians, general practitioners, and also other services. There's a first level service, which is the youth space and the adolescent outpatient clinic. And there's a second level approach when comorbidities emerge. So there is a reciprocity between the complex services and teams and this team in a two-way approach. And the need to have friendly and non-discriminatory places. I'm speaking, for example, for toilet, okay? And the waiting room, where the calling for appointment time is certainly the best approach, but sometimes this needs to be changed. Special attention, again, to language. Better call a person with the last name and not with their first name, which might not be the name they think it is appropriate for them. In the outpatient clinic, promote inclusive conversation. So collecting the name of choice and put it on the electronic data, okay, that they have. For example, good morning, today we're taking your blood. I am Marco, nice to meet you. What's your name? Alice. Alice may not be the name of the person, but it is the person you have to note for another appointment eventually. Okay, thank you. I think I'll make it. Okay, so the first assessment is carried out by professionals from the psychological area or the family counseling center. For children under 14 years of age, there's a psychosexologist that works together with a psychologist. For people who are over 18, the team is supplemented by professionals from the mental health disease because often there are some of these problems. Emma talked about the stress, which all the diseases she spoke about are in effect diseases linked to a very chronic and toxic stress, which this vulnerable population experiences. And so there's a taking charge of the patient with a multidisciplinary approach, which integrates all of these disciplines. There's a diagnostic definition, and after this, there's the activation of the process of information and communication of the care plan to the person. If it is minor, the request comes from the family. Otherwise, it can come directly from the person. Okay? There's a third level, which goes over and the pediatric and adult endocrinology consultation at the University of Bologna. And in this case, if the child is under 16, there's an evaluation for hormone therapy for hypothalamic blockade with triptorelina. If he's over 16, the evaluation of an HRT, hormone replacement therapy. And after the age of 18, the surgical therapy could also be considered. In the Emilia-Romagna region, they guarantee free therapy for hypothalamic blockade or for HRT. It is within our public health system. Once the gender affirmation pathway has been completed, the referrer will provide the person with a concluding report of the pathway, clinical and social pathway, with evaluation and the possible conclusions of this pathway. And this report will also be used to petition for the competent court for authorization for registry gender reassignment, for example, a name change and so on, depending on the problem. And points of strength. Well, the points of strength are here. We have just started, and so we have to evaluate them in the next, let's say, 5 or 6 months, but it is a service born from the basis, from the interception of needs, okay? There is an optimization and an adaptation of existing resources. It is a public health system, so it is guaranteed to everyone, not only for people who have money. And we plan to provide, and they are just providing now, ongoing training and an external supervision on cases. And another point of strength, it might be the possibility to export this experience, not only in Italy, but where the context may be able to do this. Critical points. We cannot compare this with other experiences because, at least in Italy, we don't have at the moment other experiences of this kind. There's a knowledge of gender identity issues, but as I said before, there's a great lack of training in the pre-service, which is a key point, okay? And give unique but not exclusive answers and work on one's own prejudice. This is another issue, and on the level of organization, but also on the personal configuration. So I thank you. I think I stayed in the time, and thank you very much for your attention.